The Medicare annual enrollment period is underway, and Medicare eligible people have a lot to think about before they choose a health plan. Now, most people weigh factors like cost and access to their doctors, but few think about how personal health goals should impact their plan choice. It can get pretty tricky. So today we have Christopher Ciano, head of Aetna Medicare. Now, Christopher, why is it so important for everyone to be knowledgeable about this coming into this period?
Well, it's very important because the annual enrollment period is running now through December 7th, and that's where you have to make choices on your plan. And setting health goals is pretty critical because if a Medicare beneficiary can set specific goals, small or large, we then can help them with the Medicare Advantage plan sort of achieve those goals, whether it's running a 5K, spending time with their grandchildren, or even travel, because those things are important when you look at a plan.
Now, I mentioned earlier how tricky this can get sometimes. So what are some things that people need to look for within their plan before they enroll?
Yeah, I mean, the plans vary by county, by state, so it is very important to look at the details. So you need to ask yourself, for example, are my doctors, hospitals, and pharmacists in the network, and how will I be able to access them? If you have medications that you're on, you want to look to make sure those medications are on the formulary and what costs they may be from a copay or coinsurance perspective. And affordability, right? What type of affordability from a plan premium perspective or coinsurance perspective there is. So if you have certain needs, you want to make sure that plan is going to meet your needs because we want to avoid surprises later on.
And now we're talking about how coverage changes and it varies state to state. So what are some changes that, that have happened in the past year?
Yeah, actually the Medicare organization has made some changes this past year that has expanded the definition of what we call medical benefits. So it allows Medicare Advantage plans to be much more holistic in designing our programs around specific needs for Medicare beneficiaries. So for example, it allows us to start thinking about providing grab bars inside the home if someone is unsteady when they take a shower, or non-skilled aids inside the home, or ramps and things like that. So whereas we were limited before, I think you'll see both in 2019 and 2020 Medicare Advantage plans being able to be much more holistic around independent living and assisting our beneficiaries in a different way.
Now, Christopher, some of our viewers at home, they may be still in the research process, so where can they find some more information?
They can actually find a lot of educational materials and education on Medicare Advantage plans at aetnamedicare.com/learn. They can also go to medicare.gov, where there's a lot of information available there also.
All right, thanks so much, Christopher.
Thank you. Have a great day.
A special thanks to Aetna for sponsoring this segment.